Hi, I'm Dr. Rajani. Thanks for joining me today. Your Botox may be aging you prematurely. What the heck is that all about? I was asked by one of our viewers in the comment section. She's 39 years old, been getting Botox for about 4 years. Since that time, although it stops the muscle movement and she looks a little bit better for a month or two, she feels like overall she's looking older. So that was the question I'm addressing. If you like the videos, smash that like button and we'll dive into this one because it's very important to understand the concepts. It's going to be a quicker video, but to understand, the first thing we need to know is how Botox works. And what it does is it slows and stops the muscle movement. Now, we're picking on Botox a little bit because it's a brand name, but understand Botox, Dysport, Xeomin, you hear of Jeuveau. They're all more similar than dissimilar. I have videos on the differences for sure. And if you want to know the science, I'll put a link at the end of the Botox playlist because I go through how they work, the exact mechanism of action. You don't need to know this for the video. I'm going to tell you 3 ways in which Botox may be aging you prematurely and maybe what this viewer is talking about because she actually has a great point. The first thing is it can mask the problem. So the problem of aging is collagen loss. It's loss of skin glow, it's sag, it's bone loss. But what Botox-like products do is they stop the muscle movement. The common areas treated would be the frown, the forehead, around the eyes, the masseters to slim the face, and the muscles around the lips to prevent vertical lip lines, and the pulling down at the edge of the mouth, the chin and the chin dimpling. Those are the most common areas used. So this person was seeing that she's aging more over time. Botox is not anti-aging, it's anti-muscle. So what it can do is mask the underlying problem of collagen loss, loss of structure, increased muscle movement amongst bone that doesn't exist very well anymore. And that's why my video on the one vitamin deficiency that might be aging you is important because we talk about bone loss and vitamin K2 there and things you can do. And it's why we use biostimulators to give structure for the skin. So eventually the Botox-like products are not going to work in that environment. While Botox directly isn't aging this person, it might be stopping the muscle movement. You get that hit of lack of movement, makes you look younger for a month or two, but without structural support and addressing that collagen loss that we talk about on this channel, it can mask the problem to the point where it will no longer work. And keep in mind, at about 38, 39, the aging rate is going way up, especially in a thin, white female. The reason I say it is that the skin type will affect the person in terms of how the sun damage affects them, as well as thin white female bone loss. So all those factors as opposed to different skin types and bone structure. So in some people, 39 is where the aging rate really increases. For others, it's more mid-40s. The number 2 reason is, remember, it slows muscle movement down. So you get atrophy, you get shrinking of the muscles, which is a good thing because you need less Botox-like product or Botox on your subsequent visits if you stay up on it. But it's a bad thing in certain areas because imagine the muscle in the glabella or in the frown takes up some volume. And what do younger people have that make them look younger often is volume, size. It takes up some of the space. Another area would be the temple. If people are injecting too lateral at the crow's feet, you lose temporal volume, you get a scalloped temple, a drooping of the eye because the temporalis muscle, laterally a muscle of mastication or chewing, shrinks. And now you look old for it. A masseter, if you're treating masseters and the skin isn't good, you can get a downturned mouth. That's going to make someone look older. So muscle atrophy could be one of the things that she's talking about. Finally, the third, if we think about the muscle movement, what do so many people on this channel say? Those who get Botox and fillers, they look unusual. They look odd. They look weird. I'll never do that. What they're talking about is the lower face, especially treating the muscles that pull down the edge of the mouth, the chin. They're very interconnected, and to articulate words, to smile, to look normal. As we manipulate those muscles, people can look odd when they move, talk, articulate, or eat. And that can make someone actually look old. Add in a little bit of filler there, and they can look older. So that's why I talk about biostimulators all the time. Building collagen, nutrition, exercise, lack of sun exposure, topicals. The less filler and Botox-like products a person does, the better. The more towards biostimulators, the better. So you have to, and fillers are great, Botox is great. It just can't be the only show in town. It has to work with everything else in harmony to produce a great result. And part of the responsibility lies upon the patients to not smoke, to take care of their skin, and do all the things we talk about on this channel. Botox itself won't necessarily age someone in terms of the process or the biochemistry, but those are 3 ways in which it can. I put a complete playlist right up here on Botox, Botox-like products, and I put one down here on how you can increase your collagen at home, the things you can do at home to avoid getting treatments done. Make it a great one. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.